I'm Morie Gertz. I'm chair of the Department of Medicine at Mayo Clinic, Rochester. I've been attending ASH for 30 years, but this is clearly the most exciting one for patients with multiple myeloma. Multiple truly breakthrough trials have been reported. 3 specifically on stem cell transplantation. One, reported by the French, demonstrated a superior progression-free and overall survival for tandem transplant compared to single transplant for those patients with high-risk features. A second showed the safety of stem cell transplant and improved quality of life in patients over the 65. A late-breaking abstract from the BMT-CTN to be reported shows no difference in overall survival or progression-free survival in patients that have had a transplant followed by maintenance lenalidomide compared to patients who have a transplant consolidation with bortezomib lenalidomide followed by maintenance and those with a tandem transplant. That would suggest that maintenance alone after a transplant is sufficient, although this trial has not done a subset analysis of high-risk patients or by stage, so more data will be required. Having said that, there are many new agents that have been reported. Selinexor appears to be active in patients who failed 5 different regimens. Venetoclax, particularly for patients who have translocation 11-14, appears to be highly active with response rates in excess of 40%. The combination of carfilzomib, pomalidomide, and dexamethasone appears to be highly active in patients with relapsed disease, producing response rates in 70% of patients with complete response rates in 30% of patients. Overall, many new prognostic factors have been introduced. Circulating cells at the time of stem cell transplant appears to be a new prognostic factor that predicts for adverse outcome. I think we're moving closer to the cure for multiple myeloma. There's been extensive reporting on monoclonal antibodies, new information on the use of daratumumab in various combinations for patients with myeloma. Now there's an antibody for BCMA, which is a membrane antigen on all myeloma cells that by itself shows activity, and when combined with a T cell to make it a BCMA CAR T cell appears to be active. A very exciting ASH and very good news for our myeloma patients.